Welcome to Spinal Aid, Atlanta's #1 franchise decompression facility. My name is Dr. Timothy Dembowski, and today I'm going to take you on a little tour of our facility. We like to consider ourselves the center of excellence here in Atlanta when it comes to natural medicine. We offer a wide range of therapies ranging from non-surgical spinal decompression to needleless acupuncture. My goal here today is to enlighten you on what one can expect when coming to see us, the different therapies we offer, and why our office stands out from the rest. As in any doctor's office, the first thing a patient will do when arriving is filling out the necessary paperwork that is required. This information will help us in detecting where the problems are, how they might have arisen, and more importantly, how can we best treat them. If the patient has any current x-rays, MRIs, or other current imaging studies they'd like the doctor to look over, it is requested that they are brought during their initial consultation. After the paperwork has been completed, the patient will head back to the main office in which they will start watching a brief video on our virtual doctor. We use the virtual doctor as a tool in our office to combine hard facts with animation and illustration in an effort to educate our patients on the decompression therapy. Once the video is finished, the doctor will come back in and sit with the patient to further discuss any and all issues that have brought them in the office. Once the consultation is completed and a brief exam is given, the patient will then dive right into the first treatment and thus begin stage 1 of care, the pain relief stage. In 10 years of practice, I have learned that nothing in the body happens in isolation, meaning if you feel pain in one area, it is more than likely not isolated to that one spot, but a combination of other poorly functioning systems that reproduce a painful symptom. For this reason, we like to investigate the different facets of our body's running systems. We usually start off by doing a detoxifying foot bath that is used to draw out toxins stored in our body through the pores of the feet. We have 2 detox machines in our office, both made by industry leader Erconia. Research has proven that these machines help maintain the body's proper pH levels while restoring the body's balance and energy levels. As you can see, the water starts off as a clear tap water and after about 20 minutes turn all different colors, each color representing toxicity being stored in different parts of the body. Now don't be alarmed at the color of the water, as it is normal to see major color changes as our body readily holds millions of toxins acquired from the air we breathe, the food we eat, and the medication we take. We have had great success stories with just the detox, as it has many fantastic advantages along with aiding the healing process. Once the foot bath is completed, the patient will be escorted across the hall into the examination room. In this room, we will run a series of different tests to help correlate the patient information with what the body is telling us. We pride ourselves on being cutting edge in this office, and that's why we have so many different therapies. Our goal is to get you healthy here and not refer you to someone else. In this room, we gather and perform the majority of our analysis and treatment, whether it be through a chiropractic adjustment by way of percussor, nutritional analysis, needleless acupuncture, or cold laser therapy. The information gathered in this room is very important to us to help us better achieve your personal wellness goals. After this step is complete, the patient will then go into the decompression room and start the third part of treatment. The decompression process itself is a painless procedure that starts off with the patient getting into a 2-piece harness which the doctor straps on. The doctor then loads the patient onto the table and slowly lowers them down. Once the patient is lying flat, the doctor tightens the straps and connects the harness to the table at the top and bottom. Then a wedge is placed under the patient's knees and a pillow under the head. This is a very relaxing position for the patient and usually induces a twilight sleep during the actual procedure. The strap that connects to the harness is angled so that it can specifically pinpoint a desired vertebral level. During the session, the strap goes through a series of loosening and tightening, which subtly works on repairing the damaged disc. The same holds true for the neck region as well, except the patient is not in a full body harness, but in a harness specifically designed for the neck region. The average time on both tables is a little more than 20 minutes. When the session is over, the doctor will disconnect the strap that holds the harness to the machine and table, remove the head pillow, leg wedge, and begin to lift the patient back up to the standing position. After the patient is off the machine, the harness is taken off and the decompression session is completed. After the decompression session is complete, it is time to engage in the final step of our visit, electrical muscle stimulation. We incorporate muscle stimulation via the H-Wave machine during every visit as it serves multiple purposes. H-Wave is one of the most unique and effective products available for improving function and managing chronic, acute, or post-operative pain. The H-Wave device was specifically designed to improve circulation and enhance fluid shifts, thereby addressing the inflammation that is so often the causative factor in pain. By simply placing adhesive pads on the skin and connecting to the device, H-Wave can create a very comfortable and strong muscle contraction. A 30-minute treatment will contract muscles and increase fluid shifts in the area, significantly addressing symptoms in the most rehabilitative way possible. These pads can be placed virtually anywhere on the body the patient is feeling pain, and in turn offers great relief to those areas. Once the patient has finished this aspect of treatment, the session is over for the day. The FDA recommends for optimal disc healing the patient should be seen 20 times. In this office, we usually recommend twice a week for 10 weeks, which we have found gives the body the optimal time to heal in between visits. We are open Monday through Thursday from 9 to 6 and Friday from 9 to noon. We accept most insurance and have many flexible payment plans in an effort to make treatment affordable to anyone who needs it. Please call us for a free consultation, as we would like nothing more than to add you to our growing list of success stories.